I think we will need to conclude. But before we do so, I wanted to ask Dr. Bianchi if he would conclude our sessions today, really, and with any reflections that you wanted to share. I think I mean, I
Yes.
could say the last three sessions, I mean, mine was mine, but our two speakers were just absolute stars, and I'm just so thrilled to have had them. But Dr. Bianchi, please.
Absolutely. Thank you so much, Dr. Jacobson-Dickman, for giving me the opportunity. So I'm Riccardo Bianchi. I'm the Associate Dean for Foundations of Medicine, the pre-clerkship years here at Downstate. And I've been following these presentations with real interest and excitement. So thank you. So the first thing I want to do is clearly to thank the speakers, Dr. Chase Anderson, Dr. Elka Jacobson-Dickman, and Dr. Miriam Hoffman as the last presenter. These were all great presentations. And I think everyone here has realized how much questions or reflections these presentations have stimulated. I think I would like, as a couple of closing remarks, I'd like to go back to the title, I guess, of this symposium, because I think there are some keywords that really help us go, summarizing what we've talked about this morning and seeing a real thread throughout this extensive and complex areas in medical education. So the symposium is like progress and professionalism, cultivating an environment of tolerance and growth. And, as progress is essentially our overarching mission of all the, those of us who work in medical education, biomedical research, and clinical practice, to advance healthcare so that everyone receives the needed care to treat medical conditions, but also to prevent disease and to promote wellness. And professionalism is clearly essential to this process. And it's multi-layers, it's complex. We are all involved in our sort of daily challenges also. How do we teach professionalism? What is professionalism? How is it defined at the institutional level? How do we assess students, given the professionals is a competency-based education? How do we reward professional behavior, and how do we use positive reinforcement for it? And how do we address professionalism comprehensively? And I think that of all the different aspects, the talks this morning have enriched our view of professionalism, bringing in the issues related to minority stress, as Dr. Anderson has talked about in his first presentation, how bringing actually evidence, data on how minority stress affects mental health. And I think we all appreciated not only, of course, is like concrete suggestions on how we can all use to approach examples of microaggressions and how we can all team up to progress in this area. But also, they've been, he's been incredible, I think, in really courageous to share his personal experiences. That's been really powerful, and we've seen how that has led us also to sort of open up and sharing personal experiences, intimate moments that allow us to grow. The second talk, I think, by you, Elka, was I think it was very, very interesting, because it brings up another aspect, another lens, that of intergenerational, I would say, differences and similarities. Let's recognize the difference, but leverage on whatever similarities, which are the same goals, the same everything, motivations, inspirations that we share across a generation when we all team up towards a worthwhile societal change. And I think that it was very useful also to kind of think about, again, concretely, strategies that we can, or approaches that we can all use to with the same goal of improving the communication with students and making real connections with them. I think that will go a long way actually to help them develop the professional identity that we expect, and help us also adjust and adapt based on cultural changes and societal changes. And finally, I want to really thank Dr. Hoffman because, I mean, your presentation personally left me very excited about the many opportunities that we can develop, of course, also at our school that we've been talking about in our school. And I would say if there's one thing that struck me was your generosity, and I was impressed that you brought it up as a part of Ken Burns' quote. You've been generous, I think, of sharing as many details as possible in such a short period of time. I would have tons of questions, which I can't even pose one of them. But I think that leaves us even more so energized in terms of like really partnering or develop, share again with each other projects, experiences, and so on. I mean, you gave us in a very short time, I think you gave us a very good idea on how your curriculum is really framed through social determinants of health, but also you build up the presentation to sort of illustrate clearly how everything is centered through a lens of humanism. And I think, that's a beautiful example also on how you can frame the many competencies and requirements for students. And you gave us also enough details to make us think about the structure and the resources. I think for me, it's exciting to think that probably sometimes we do more than we think. When I think of our students and their experiences, we do have the Brooklyn Free Clinic, which is like a golden opportunity for many students to do actually provide the free clinical service to the community. And I'm just, we have that, but we have so many more perhaps things that are going on. So thinking about how we can structure literally and frame by design a school that is more comprehensive and provides students with real in-depth experiences is really exciting. So I would just conclude by thanking the Learning Environment Committee. I'm proud to be a member of that committee and a member of the rapid response team that meets quickly and to respond to kudos and concern and of the students. This has been a tremendous program, and really, Dr. Jacobson-Dickman, Dr. Meyers, Dr. Lazar have done an amazing job in putting this together. And but I would give the lion's share of the credit to Taryn, because she's behind the scenes. She's really she's been amazing at putting all this together. And I'm glad they had the opportunity at least to comment on this symposium. And want to thank the sponsor, also the John Connolly Foundations and the Downstate division of the John Connolly Foundation, as Dr. Lazar properly introduced this morning, and the Dean's Office for the College of Medicine at Downstate that provided full support for this event. And actually, the participants, I think, deserve also a round of applause, because I think this symposium has been so lively. The participation and the sharing of very powerful moments of the participants has made it really a bit special, I would say. So thank you, everyone. And I think that where we can leave this is to wanted to do more symposia, wanted to think forward and to propel all of us into maybe creating also interinstitutional projects or collaborations, because I think we're all on the same page, so to speak. And thank you again. Thank you, everyone.
Thank you, everybody, and
I
have a
would say,
wonderful afternoon.
the many questions, maybe I would say this, the many, I'm sure there are questions and things. I invite everyone to contact, actually. I'm sure the speakers are available. They share their emails, or you can contact any one of us in the Learning Environment Committee, or Taryn. Taryn would be the best to probably coordinate and as if you have questions or contacts, by all means, go
And
through.
can I make a quick
Absolutely.
comment? Sorry, I don't want to miss a chance. So first of all, myself, as well as even more importantly, many people from my team, our faculty, our staff, will definitely be at NEGEA. We hope to have a bunch of presentations, but we'll be there. Same at Learn, Serve, Lead. We're actually presenting as part of one of the gold big sessions on community engaged medical education. So myself, Carmela Ricchetti, lots of other folks, and I'm also very happy to have more conversations and really help in any way I can. And Elke, I'll forward you those articles as well.
Thank you so much.
Yeah.